Cardio and strength training are both effective exercise types for managing diabetes, but they improve diabetes risk factors through different processes or mechanisms. In this video, I'm going to discuss the benefits and mechanisms specific to both cardio and strength training as they relate to diabetes management. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. In type 2 diabetes, both cardio and strength training are effective in improving blood sugar levels, reducing inflammation, boosting mental health, and improving cardiovascular health. And the strongest effect is when both of these types of exercises are included in a workout routine. Even though both of these exercise types help to improve diabetes, the mechanisms of how each of these exercise types affect insulin resistance are different. Cardio or aerobic exercise is essentially continuous movement of large muscle groups to the point that it increases your heart rate and your breathing rate. And so this will be things like walking, biking, jogging, and the current recommendations are doing aerobic training or aerobic exercise at least 3 days a week and accumulating at least 150 minutes per week of this type of exercise. Strength training is when you're pushing or pulling against some type of resistance with the goal of improving muscular strength and muscular power. Now, this can include weightlifting, this can include using resistance bands, body weight movements like push-ups, and machine weights as well. And the current recommendations are training all major muscle groups for at least 2 to 3 days a week. When it comes to how these different exercise types improve diabetes, let's look at blood glucose management first. In the short term, cardio has been shown to be more effective, just slightly more effective at lowering blood sugar levels, but when done over 9 months, strength training has been found to be more superior at lowering A1C. And part of the reason that strength training is better than cardio long term at lowering A1C is because of the muscle building effect of strength training. Muscle tissue is metabolically healthy tissue, and the more that you have of it, the more opportunity you have for your muscle cells to help to pull or clear that glucose out of the bloodstream and improve insulin sensitivity. And more muscle tissue also raises your resting metabolism, which means you're going to be burning more fat at rest, including visceral fat. And so visceral fat is the fat that surrounds our organs. And this type of fat, whenever it's found in higher amounts, is really harmful to our health. When we look at other diabetes risk factors, both cardio and strength training seem to be good at lowering body fat. Cardio tends to be better at improving cardiovascular health and improving blood lipids like cholesterol and triglycerides. And strength training is going to be better at increasing muscle mass and also improving insulin sensitivity. To start with mechanisms, let's look at glucose uptake first. Glucose uptake means the ability of different tissues in the body, like muscle tissue, to help to pull that glucose out of the bloodstream and into the cell. This is done in 2 different ways: insulin-dependent pathway and a non-insulin dependent pathway. With the insulin-dependent pathway, insulin gets produced by beta cells in the pancreas in response to increases in blood sugar levels. That insulin, which is a hormone, it then binds to cells across different tissues in the body, like adipose tissue, which stores our fat, muscle tissue, and the liver. And so it binds to cell receptors on those different types of tissues like a lock and key. Enzyme activity then occurs within the cell involving 2 different proteins: PI3K and AKT. This is known as the PI3K ACT pathway. Glucose transporter 4, or GLUT4, which is another protein within the cell, it then translocates or moves to the surface of the cell and helps to take that glucose out of the bloodstream and into the cell. In research studies that involve mice with type 2 diabetes, both cardio and strength training have been shown to increase PI3K and AKT within the cell without any changes in muscle mass. This means that both types of exercises can positively influence enzyme activity in the cell, which then helps with glucose uptake. In the non-insulin dependent pathway, any movement of the body itself or any physical activity, this causes GLUT4 to move to the surface of the cell to uptake glucose through activation of another protein, AMPK. This pathway is particularly important for people with type 2 diabetes because insulin-mediated glucose uptake is impaired in this condition. And we've seen stronger activation of AMPK when doing higher intensity exercise compared to moderate intensity exercise. The next topic is mitochondria. This is a part of the cell that produces energy for the cell. The mitochondria are sometimes called the powerhouse of the cell. In type 2 diabetes, defective mitochondria are thought to play a role in the development of insulin resistance. Cardio can increase the development of new mitochondria in the cell, and this enhances the ability of the cell to break down lipids or fats and also to uptake glucose. When too many lipids build up in the muscle and the liver, this is another factor that contributes to insulin resistance. The protein that I mentioned earlier, AMPK, which is essentially a metabolic sensor, it influences the metabolism of lipids. In obese mice, cardio has been shown to activate AMPK in the muscle and improve insulin resistance. Strength training has also been shown to increase activation of AMPK by up to 75%. And strength training also activates IGF-1. Insulin-like growth factor 1, or IGF-1, this is a hormone that plays a crucial role in the growth and division of muscle cells. The activation of IGF-1 improves insulin sensitivity. So strength training, it promotes muscle growth, protein development, and it helps to store glucose in the form of glycogen, which helps to maintain stable blood sugar levels. To bring it all home, cardio helps in the development of new mitochondria in the cell. It also helps to move GLUT4 to the surface of the cell for glucose uptake, and it helps with lipid metabolism through activation of AMPK. Strength training influences muscle growth, glycogen storage, and it also helps to improve insulin sensitivity by activating IGF-1. Both cardio and strength training improve diabetes through different mechanisms, and the most effective way to manage diabetes is through using a combination of both of these types of exercises. Before you make any changes to your exercise routine, please make sure that you consult with your doctor. Thank you for watching.